Imagine waking up in the morning, placing your feet on the floor, and feeling that familiar heaviness again. Your legs feel stiff, your feet feel cold, maybe even a little numb. You tell yourself, it's just age. This is normal now, but deep down, something doesn't feel right. I've had countless patients sit across from me, usually in their 60s or 70s, sometimes younger, and say the same thing in a quiet voice. Doctor, my legs just don't feel alive anymore. They talk about tingling, swelling around the ankles, cramps at night, or feet that stay cold no matter how many socks they wear. And almost always they believe there's nothing they can do about it. What if I told you that one simple morning habit, something you can do at home in just a few minutes, may help wake up the circulation in your legs and feet before your day even begins? Not a pill, not an expensive device, not a long workout that leaves you exhausted. Just a gentle, intentional habit that works with your body instead of against it. Here's the truth most people are never told. Poor circulation in the legs doesn't usually start with a dramatic event. It starts quietly, a little stiffness when you wake up, a bit of swelling by evening, shoes feeling tighter than they used to. Over time, reduced blood flow can affect how steady you feel when you walk, how far you can go without stopping, and even how confident you feel leaving the house. And for seniors especially, this can slowly steal independence without making much noise at all. I've seen people blame their heart, their knees, their shoes, even the weather. But very often, the real issue is that the muscles and blood vessels in the lower body simply aren't being gently activated at the right time of day. Especially in the morning, after hours of lying still, blood tends to pool in the lower extremities. Gravity works against you. Your circulation hasn't had its wake-up call yet. And this is where most advice goes wrong. People are told to walk more, push harder, do more exercise. But if your legs already feel heavy and weak in the morning, forcing them too fast can actually make things worse. It can increase discomfort, raise the risk of imbalance, and leave you discouraged before the day even starts. In this video, I want to show you a different approach. A surgeon's perspective that focuses on circulation first, movement second. A morning habit designed to gently signal your blood vessels, your muscles, and your nervous system that it's time to turn the flow back on. When done consistently, this habit can help your legs feel warmer, lighter, and more responsive throughout the day. If you stay with me until the end, you'll understand why mornings are the most powerful time to influence leg circulation, what most people misunderstand about blood flow in the feet, and how one simple daily habit can support healthier circulation without strain or fear. I'll also share how this fits safely into real life, especially if you're over 60, dealing with stiffness, or worried about balance. So take a breath with me. Let your shoulders relax. And know that what you're about to learn isn't about pushing your body harder. It's about listening to it more closely and giving it the right signal at the right time. When we talk about circulation, most people imagine the heart working like a pump, pushing blood through pipes. And while that's partly true, it's only half the story, especially when it comes to your legs and feet. Here's something I explain to my patients all the time. Your heart is strong, but it cannot do this job alone. The real helpers of circulation in your lower body are your muscles. Every time the muscles in your calves, ankles, and feet gently contract and relax, they act like secondary pumps, squeezing blood upward against gravity and helping it return to the heart. This is often called the muscle pump mechanism, and it becomes more important as we age. Now think about what happens overnight. You're lying still for 6, 7, maybe 8 hours. Those muscle pumps are quiet, blood flow slows down. Fluid can settle in the lower legs. By morning, circulation hasn't caught up yet, but you're expected to stand, walk, and start your day as if nothing happened. For many seniors, this is when stiffness, heaviness, and that cold feeling in the feet are at their worst. One common myth I hear is, if circulation is bad, I should just walk it off. Walking is healthy, yes, but timing matters. When circulation is sluggish and muscles are stiff first thing in the morning, jumping straight into walking can feel uncomfortable or even unsafe. I've seen patients lose confidence because their legs didn't feel steady early in the day. They assumed something was seriously wrong, when in reality, their circulation simply hadn't been gently activated yet. Another myth is that cold feet automatically mean poor heart health. In many cases, the heart is doing its job just fine. The issue lies in small blood vessels that have become less responsive over time, often due to inactivity, aging, or conditions like diabetes. These vessels need gentle signals to open up. Aggressive movement isn't always the answer. smart movement is. Let me share a real-life example. I once worked with a retired teacher in her early 70s. Every morning, she dreaded standing up because her feet felt numb and unstable. She was afraid of falling. She thought her only option was medication. But when we focused on how she started her mornings, everything changed. We introduced a simple habit designed to wake up her leg muscles and blood vessels before standing. Within weeks, she told me her mornings felt calmer, warmer, and far more predictable. What made the difference wasn't intensity. It was intention. You see, circulation responds incredibly well to gentle, rhythmic movement combined with breathing. When done first thing in the morning, this type of movement sends a clear message to your nervous system. It is safe to increase blood flow. Blood vessels relax. Muscles engage. Balance improves. And your legs feel more awake before you put weight on them. Many people assume that circulation problems are permanent, that stiffness and cold feet are just the price of getting older. That's simply not true. While aging does change the body, it does not shut down your ability to improve blood flow. The body is remarkably adaptable, even in your 70s or 80s, when given the right kind of input. In the next part, I'll walk you through exactly what this morning habit looks like, how to do it safely at home, and what small daily choices can support better blood flow throughout the day. I'll also point out common mistakes that unknowingly block circulation, even in people who think they're doing everything right. Now let's talk about what you can actually do starting tomorrow morning in a way that feels safe, realistic, and kind to your body. This morning habit begins before you ever stand up. That's important. You don't need special equipment. You don't need to be flexible. You just need a few quiet minutes and a willingness to move gently. When you first wake up, before rushing to the bathroom or grabbing your phone, sit upright on the edge of your bed or in a sturdy chair. Let your feet rest flat on the floor. Take a slow breath in through your nose, and as you breathe out, allow your shoulders to soften. This moment of calm matters more than people realize. Stress tightens blood vessels. Calm opens them. Now slowly lift your toes while keeping your heels on the ground. Hold for a second, then gently lower them. Next, lift your heels while keeping your toes down, then lower them. You're not forcing anything, you're simply inviting movement. As you do this, imagine blood flowing down into your feet and back up through your calves. Do this rhythmically, at a comfortable pace for about 1 to 2 minutes. After that, gently circle your ankles. Small circles are enough. One direction, then the other. If one side feels stiffer, that's okay. Stiffness is information, not danger. This motion wakes up tiny muscles and blood vessels that rarely get attention, yet play a huge role in balance and circulation. Here's something many people overlook. Breathing and movement must work together. As you move your feet and ankles, keep breathing slowly and evenly. Holding your breath sends the wrong signal to your nervous system. Slow breathing tells your body it's safe to increase blood flow. Once you've done this, pause for a moment. Notice if your feet feel warmer, more present, or less heavy. Some people feel a subtle tingling. That's a good sign. It means circulation is responding. From here, when you do stand up, your legs are no longer going from 0 to full load. You've already turned the system on. Now let's talk about daily habits that support this morning routine. Hydration is a big one. Blood needs fluid to flow well. Many seniors unintentionally wake up slightly dehydrated, which thickens the blood and slows circulation. A glass of water in the morning, even before coffee, can make a noticeable difference over time. Footwear also matters more than people think. Tight socks, narrow shoes, or stiff soles can restrict blood flow and nerve signals. If possible, choose socks that don't dig into your ankles and shoes that allow your toes to move naturally. Diet plays a role too, but not in the extreme way social media often suggests. You don't need exotic supplements. Foods that support blood vessel health include leafy greens, berries, nuts, and fatty fish. And one simple habit that helps circulation is reducing excessive salt, especially later in the day, to limit swelling in the legs and feet. Let me also mention a few common mistakes I see all the time. One is sitting for long periods without moving the feet at all. Even if you're watching TV or reading, gently moving your ankles every so often keeps blood from pooling. Another mistake is ignoring mild symptoms. Tingling, coldness, or swelling are early signals, not something to push through or dismiss. Most importantly, don't compare your body to someone else's. Circulation improves with consistency, not competition. Doing a little every day is far more powerful than doing a lot once in a while. In the final part, I want to bring this all together. I'll share why this simple morning habit can restore confidence, not just circulation, and how small changes like this can quietly improve your quality of life in ways you may not expect. There's something deeply emotional about the moment you realize your body can still respond. I've seen it happen so many times. A patient comes back after a few weeks and says, almost surprised, "Doctor, my legs feel different in the mornings now. Not perfect. Not young again, just more reliable, more awake, more theirs." And that's really what this is about. Circulation isn't just blood moving through vessels. It's confidence moving through your life. When your legs and feet feel warmer, steadier, and more responsive, you walk differently. You stand differently. You make plans without silently worrying about how your body will behave. This simple morning habit works because it respects how the body is designed. It doesn't force, it doesn't rush. It gently reminds your muscles and blood vessels of a job they still know how to do. Even after 60, even after 70, even if you've been inactive for years. I want you to remember this. Aging does not mean decline is inevitable. It means the margin for error gets smaller and the need for consistency gets greater. Small daily habits, especially in the morning, have a powerful ripple effect. When you start your day by helping circulation, everything that follows becomes easier. Walking feels smoother, swelling is less intense. Balance improves. Even fatigue can feel lighter. You don't need to change your whole life overnight. You just need to change how you begin your day. A few minutes, a chair or the edge of your bed. Gentle movement, calm breathing, and patience with yourself. If you take anything from this video, let it be this. Your body is still listening, it's still adapting, and it's never too late to give it the right signal. If this message resonated with you, I invite you to gently support this channel by liking the video, subscribing for more senior-focused health guidance, and sharing your experience in the comments. Your story might be exactly what someone else needs to hear. Thank you for spending this time with me. Take care of your body. It's been taking care of you for a long time.